Hello, I'm Marina Kukla. I'm a clinical psychologist and a research scientist here at the Richard L. Rodebush VA Medical Center. I'm also the SMI rotation supervisor for our predoctoral clinical internship program. I'm going to tell you a little bit about the SMI rotation today and what we have to offer. So this is an outpatient rotation out of our Psychosocial Rehabilitation and Recovery Center, or PRRC. In this rotation, you will work with a number of patients or clients with serious mental illness. They may have things like schizophrenia spectrum disorders, bipolar disorders, depression, PTSD. They may have a number of personality disorders and other comorbidities such as substance use and serious medical conditions, as well as a number of psychosocial barriers and other adversities. Many of the people we work with have lower socioeconomic status. They may have housing instability and a number of other factors. In our clinic, we have a number of psychologists. Two, myself and Laura Faith, are particularly involved with the internship program. We also have a number of social workers, including our clinic manager. We have a nurse, we have a psychiatrist and other medication prescribers. We have a peer as well. So we have a number of people working in both social work and in therapy roles. And interns often play this role in therapy. So you would have a number of individual clients that you would meet with regularly and engage. You would also work in group therapy. We have other experiences in assessment. So you might do neuropsychological assessments. You might do personality assessments, which are geared towards determining, is this person's difficulties and functional deficits coming due to or coming from their psychotic disorder, or might it be stemming from or driven by other things such as a personality disorder, a mood disorder, or substance use driven. There are other experiences as well. So our interns have often been involved in working in our larger training program. You might have experiences assisting in providing supervision for some of our graduate practicum students as well. We also have a number of research opportunities here. I've been here for 13 years and working in both a research and a clinical capacity, and now taking over as the SMI supervisor. And we have a number of research studies. I have a number of studies looking at research approaches or recovery approaches for people with serious mental illness. We also have a number of other forms of research. Many of our interns have been involved with doing lit reviews, analyzing data, both mixed methods, quantitative and qualitative data. So I think there are many experiences in looking at what factors are associated with or driving psychopathology and the difficulties that we see or the patients that we work with often experience. We've also been able to think about what interns are interested in and try to form research experiences around those things. As I said, as a researcher, I have a number of active studies going on. And so many of our interns and other trainees have had the opportunity of being involved in those studies when that's something that they're interested in. So day to day, you work with the team, you come in, you have your individual patients, you have your groups, you do supervision. We have a number of other scholarly activities going on. We have a journal club, we have a book club. We have a scoring group who is involved in our metacognitively oriented therapy and in scoring the assessments where people talk about their lives and their challenges. We call that the IPI. Some of our interns have been involved in learning that. As I said, the model that we use here is that we view people with SMI's deficits in terms of their difficulties integrating information and making sense of that in terms of themselves and their lives, where they fit in the world and how they might respond to their challenges. We call this metacognitive capacity. And the therapy that we use here is called MERIT. It also looks at how do we promote these capacities in people. Other people are able to integrate this MERIT approach with things like CBT, humanistic approaches, other types of therapy approaches, which are commonly used. So we are using Merit, which was, of course, born out of the work of Dr. Paul Lysaker, late Dr. Lysaker, who was previous to me. He was the SMI supervisor here. And so we are really continuing his legacy in this work of approaching people's challenges in this way and thinking about what we can do to help promote those things. So this is the SMI rotation. I'm so excited and looking forward to speaking with you during your interviews and learning more about you and answering any questions that I can. Thanks for applying.